right, hello everyone. Welcome to another episode of the Dose Zero podcast. Today we are with functional medicine doctor, Dr. Cathy Kim. Thank you so much for being with us here today.
It's a pleasure. Thanks for having me.
Appreciate it. I'm super excited to talk to you today.
Great.
So one of the first things that I want to start off with is kind of your transition from a traditional medicine background into functional medicine.
Mm-hmm.
Could you elaborate a little bit on your educational background and how you ended up getting into functional medicine?
Yeah, sure. I was a conventionally trained MD,
Mm-hmm.
and I was practicing just the regular way you expect when you go to any doctor.
Mm-hmm.
And then I happened to have an injury that gave me a lot of nerve pain.
Okay.
And so I already understood all the pathways for what I would do, send you to PT, that might not help. And, so I thought, well, I'll use this as an opportunity to try to investigate the other alternative ways of healing.
Right.
And when I'd been in medical school, I had been very interested in holistic medicine. So
Mm-hmm.
I was part of a holistic medicine student interest group, and we put on seminars on shiatsu massage and Ayurvedic medicine. So I had that interest already of from decades back. So
Right.
Anyway, so then it was an opportunity on myself to investigate that. So that's when I went to many chiropractors and holistic whole body physical therapist and acupuncture.
Mm-hmm.
And I was just constantly amazed that this other world existed in helping people that I was not exposed to in the conventional medicine world of standard referrals and what
Right.
I have available.
Right.
And so it was one of those where it kind of happens to you,
Mm-hmm.
like as it was helping me, and then I would see patients in my conventional way and be like, well, I can't prescribe you something for that.
Right.
I think we should try this for that. And as that got as that helped people immediately, or opened up things for them in their world of pain.
Right.
That's when I was like, okay, I'm gonna leave doing it this way and see what happens. Trying to help people a different way.
Mm-hmm. What kind of injury was it that you had?
Oh, I fractured my wrist. So
Okay.
I had a big fall, and I fell backwards, and I fractured it. It almost needed surgery, but I was
Mm-hmm.
lucky, and it was not all to the point of needing surgery. And then after I was done, out of the cast and all, is when I had this nerve pain.
Okay.
So that's why it's unusual, but I never had any imaging for it,
Mhm.
because I thought, hey, if I herniated a disc giving me pain all the way in my whole arm, that would have happened at the time of the fall.
Mm-hmm.
So I think my perspective is, having had gone through many results, x-ray results and CT, MRI results, and seeing them, almost everybody has interval worsening.
Mm-hmm.
When they do another one, it's almost always interval worsening.
Right.
And I didn't, whereas when you look at pictures of yourself and you're like, I was this then, or I was this heavy then, like, that's not who you are for forever.
Mm-hmm.
But I feel like medically, when we get these kinds of medical pictures,
Right.
that's what people think, that's who they are, like that's what they have forever.
Mm-hmm.
But the body is amazingly resilient and adaptive, and I
Mhm.
think that if you are paying attention, you could probably alter some of the things that make things that are making you worse. So
Okay.
I didn't want to get the imaging so that I would be attached to whatever that said that it was, because
Right.
I was pretty sure that it was modifiable, whatever
Okay.
I went through, because had it been something kind of very dramatic that needed surgery, then then I would have had a disc out,
Mhm.
and then where was that the whole time I was
So
casted?
you attempted to treat your nerve pain as a result of the injury
Yeah.
through conventional methods,
Yeah.
but you ended up deciding to use functional medicine methods?
Well, I never actually did conventional. Like,
Okay.
I never went to I never
Mhm.
did that. I just used that as the entry point
Yeah.
into trying completely different, because I felt like
Okay.
I kind of knew all those other options I
Mhm.
had. And so I didn't really try. And then once I was working with people and I was not prescribing, and I would try to help them with their symptoms. Not
Right.
always pain. It could sometimes be a symptom. Like they just one woman had bad nausea,
Okay.
another person had terrible, like kind of chest pain, shortness of breath. Someone else was having just the dizziness. So these are not pains, they're symptoms. So
Right.
as I was able to like figure that out and just try things, then I thought, well, what is this? Like, what
Right.
is this that I'm doing? It's not chiropractic. It's not physical therapy. I didn't understand the name for what it was. So around 2017 or so, someone told me, a nurse told me, I think what you're doing is functional medicine, which is like root cause. And I was like,
Okay.
oh, maybe that's that.
Yeah.
So that's how I started to be able to think, okay, I'm going to call myself that what I'm doing is root cause, because it's pretty root, this what the way of perspective I have.
Yeah.
So anyway, so that's when I started to go to the conferences, and I presented a poster a couple of times with my kind of work there. And
Yeah.
so anyway, so that's how I got into it, I guess. So.
Yeah, root cause medicine is something that I've seen that has started to make its way into mainstream media now, and people are really starting to see that treating symptoms isn't necessarily the best course of action when certain pathologies or different injuries can be preventable.
Yeah.
What I think would be really beneficial for our audience is to kind of give a summarization and overview as to the definition of functional medicine. What really is functional medicine, and what does it look like when a patient comes in and they want to get a consultation by a functional medicine doctor? What are some of the things that you look at, and kind of how it varies based on case to case?
Well, functional medicine is looking at, instead of just looking at when people have symptoms and then they like, so the broad stroke way to say it is that conventional medicine is looking at the labs, looking at the symptoms. You have pain, we'll do PT for it, or imaging, or inject it, or medicate it. So that those are the things that we would do. So functional medicine is more, because looking for the root cause. I would say overall functional medicine is mostly biochemical and kind of maybe biochemical oriented, like because it's like talking about, it's a lot of labs, looking at your levels, looking at your microbiome. These are all lab oriented.
Right.
So so I would say in a broad picture that's what functional medicine is looking for disruptions in that.
Okay.
And then saying like, oh, this is showing an imbalance in this pathway, we should help you with this, you should quit eating as much of this and then shape it better, we should support you more with more supplements, or this kind of that. So I'd say functional medicine seems very is mostly oriented towards that. So if you see, it's always kind of a lot of diet and supplements, of course brain health, but that's all supported by your diet and supplements and your gut health.
Yeah.
And so I think that the reason I call myself kind of functional integrative is because I don't just do that, because when you go to the functional medicine conferences, there's not very much on movement or your structural.
Okay.
So functional medicine is more interested in like the biochemical aspect, whereas
Gotcha.
I'm interested in the structural aspect. So then that's how I got into going to the Fascia Research Congress, presenting my work over there, publishing our paper. So that's why I'm more, you call me like functional integrative, because I do care about those things, and I care about the whole structure, like the way the whole body works.
Yeah.
So
Yeah, like
hopefully
the way
that answers that, because I'm
100%.
I'm kind of like functional plus, or right.
Yeah. In my eyes and what I've heard in my experience is functional medicine really focuses on the interacting systems of a person's biology. And it looks to support those systems and figure out if they're malfunctioning, and to provide natural interventions to restore that function within those systems, instead of allowing the systems to malfunction and then treating the overarching symptom. Would you say that that's an accurate depiction?
Yeah, I think so. It's like technically more accurate for what they're doing, because it's really a lot of biochemistry, right? And then that's what you're looking at when you look at the results. So you're like, oh, they're built up too much of this metabolite. Why is that happening? And because it's like there's a whole area of nutrigenomics now where it's like, oh yeah, you're missing that, you have a mutation in that enzyme, you can't do that. So so Yeah, and then that imbalance in how you metabolize ends up giving you a bunch of symptoms.
Yeah.
Mm-hmm.
So within functional medicine, as we were talking about, there are kind of different subcategories and different specialties. What is your primary specialty within functional medicine? What do you focus on?
What do I focus on? Well, it was interesting. When I went to one of the conferences and bringing my perspective with fascia, trying to find a way, a tribe of interested professionals helping fascia from a pathophysiologic standpoint, which is all to say that almost all the orientations of fascia you were seeing at that time, like 8 years ago or so or more, were in about 10 years ago. The orientation was really about pain and muscles. What I was seeing was that it maybe is why some of the things that we've been treating with medication, why driving the symptom. And that, in my experience, was not metabolic. So I presented, for instance, on like TMJ pain, and so that's temporomandibular joint pain. People commonly will complain of that, and they see like oral surgery or dentistry, and so and I thought, well, that people don't usually think of that as being something involved with your fascia farther away.
Right.
So and I was talking to someone in nutrition who said, well, for that problem, she gave me a list of nutritionals she would use to support this problem.
Okay.
And but so my perspective was more that it was a structural problem, and definitely when you get your tissue inflamed from like improper nutrition, that's going to make the tissue then more stiff or more easily kind of swollen, of course. But if you continue to have tension on that from a structural standpoint, you're always going to be behind.
Right.
So that's the aspect I bring, is that I would say that we need to be simplify it a lot, we need to be like a 3-legged stool for optimum health, which is your structure needs to be somewhat elastic and adaptive to how you're moving, and then that will keep this structure from going too far askew. And then we want you metabolically also like kind of adaptive and flexible and able to absorb all the stresses of like eating too much one day, not having exactly what you need, because it's everything's like flexing all the time.
Right.
And then the third part was your nervous system. Like, can you have a very relaxed or adaptive vagus nerve, so that you can, with your vagus nerve, so you can be resilient emotionally for all the kind of unseen stresses, emotional, mental stresses in life.
Yeah.
So anyway, that I would say is how I look at functional medicine, which is like maybe kind of 2 more equal-sized legs than just looking at support nutritionally or biochemically.
Very interesting. I haven't heard much or researched much about fascia. Could you give myself and the audience a little bit of explanation on what fascia is, how it works in our body, and how it can also lead to chronic diseases or symptoms that you might end up coming into the doctor's office for?
Okay, I will try.
Okay.
Because, they have a whole nomenclature committee.
Okay.
And there's like, apparently it's quite political in terms of like, how are you actually going to have a formal definition? The definition that I saw and read, I can't even memorize enough to tell you. So for the technical definition. So it's, I guess, and so it is it's more almost easier just to explain that they used to think fascia was just the covering for all your muscles. Like you have a cadaver and like you have to get through this like white covering that's kind of stiff, encasing everything. You gotta cut through that, find the muscle. Cut through that, get to identify the nerve, identify the tendon. So they finally realized, like almost 3 decades ago at least, that it's actually maybe an organ. So that's not, it hasn't been given that title yet, but they're steering that way. So it encases everything, like your whole body, so it unifies your body, acts as a whole system, communicating. And you have like 80% of these fibers are are afferent, meaning that they go away from your body towards your brain. So they're giving information to your brain. So fascia doesn't have any fibers to make it do something. It is just receiving information and helping you adapt to what's out there. So fascia is fascinating to me. I think I think of it as it's the transducer. The transducer from from how we live in this world of this information to go into your body. That's the way that I look at it.
Kind of an absorber of all things stress and environment related and communication to your brain.
Exactly, and then your body adapts. So an example for structure would be that if you always stand a certain way, and you don't and your job is like you're a security guard or something or a cashier, and so you always stand a certain way, so you're not using your muscles in a very dynamic way. Your muscle might always be like kind of contracted, and over time it would just kind of stay that way. So your fascia kind of like helps remodel and doubles down on that and says, well, that's what you need me for, I'm here for you. And so it'll like do that, and that's how you might get like like scars there, whatever, because if your muscle's not really robustly contracting to fully stretch out all its fascia, all the fascia covering, then it might like stick on itself. So my example to people is think about physio tape, because it's the closest example you can think of. That if physio tape is like a little bit is both on you, but then it's like got extra, it's going to stick to itself. So so if you almost never fully use your muscle a certain way in a very elastic, robust way, then the fascia over it might not get fully stretched anymore because you're never using it. So then it will stick kind of to itself. And this, in a very non-academic way, is how I think of these adhesions that we get, because it's adapting to how you move. So that's one way that your fascia
it seems like a very
structural.
Intricate and complicated system to me. I mean, if it were to be able to communicate to the brain, I would question what is the cellular and biochemical composition of fascia. When I see it, I've seen fascia before just from hunting, and skinning animals, and kind of that white mesh structure. You would think it's composed of an array of microtubules. We know that neurotransmitters can be transported along microtubules. Potentially that's a mechanism for how it communicates with the brain. But then in terms of adaptability, it almost acts as a muscle as well. So it's essentially a combination of a musculoskeletal, structural component with a communication electrophysical component.
Absolutely. It helps your body, aids in the pumping action. Because, because if it's unifying and it's all like structure all over, right now they have that G-lymph, like all the brain needs to drain and circulate its lymph for your brain to work well. Well, if your fascia is stiff, then your movement is probably not going to do a very good job pumping all your lymphatic, especially the G lymphatics, to help you with your brain. It's not going to help you very much. So you want to. So you would. It's in your best interest then to help your fascia, help you, function better metabolically and structurally. So that's what I'm interested in. Is that it is right there doing multiple jobs.
And I would say that directly correlates to what we would see in chronic disease and in medicine, because your lymphatic system, it's a primary highway for your immune cells to develop. So your immune cells move through the lymphatic system in order to germinate and to reach specific compartments where they can essentially expand and turn into B cells, for example, and create adaptive immunity. And so if you have a backed up highway, it would essentially take a toll on your immune system, and you'd end up in the doctor's office. That's just kind of how I'm interpreting it off the spot. But
and I was interested to learn that in this that extracellular area where fascia lives, that's where 90% of your body's toxins live. So the stiffer your fascia, the more stagnant everything's going to be.
Mm-hmm.
Because if your fascia is very elastic,
Mm-hmm.
as you're moving, you're pumping it to move
Right.
it everywhere.
Exactly.
But that is not happening.
And
in
so
a lot of
without the
people.
movement, you'll get less drainage of those
Yes.
cellular toxins that get moved into your lymphatic system for drainage.
Mm-hmm. Yeah.
Yeah.
So interesting. So fascia has that structural kind of way that it works, right?
Mhm.
And then we were talking about, so that's a structure pump mechanical way.
Mhm.
And then you think about the metabolic way, like, so interestingly, when the fascia has like fluid, we were talking about that,
Mhm.
and then like hyaluronic acid is known
Mhm.
as something like in between, and the quality of that is related to nutrition. So the poorer your diet is, the more then the quality of that goes down, and then
Wow.
your fascia becomes sticky. Because
Uh-huh.
your fascia is useful to you as like gliding layers, because there's different layers of fascia.
Mhm.
And so we have the structural aspect of why it might decide to start to stick to itself.
Right.
Then you have, that's just like, let's say, one layer,
Mhm.
but then over the way you're using your body, and then nutritionally you make the layers sticky.
Mhm.
Now they're going to be even more stuck together. And then in terms of like body emotional memory,
Mhm.
because your body is storing memories in your fascia.
Right.
So because look at all the afferent going back to your brain.
Yeah.
So then that's the whole like kind of vagus nerve, like your whole
Mhm.
equanimity, all of that. So
Yeah.
the emotional aspect. So there, all fascia's there for all three.
Yeah, that makes actually a lot of sense. That's a great way to explain it.
Mm-hmm.
Another thing that I'd like to touch on would be in our modern day society, especially in the United States, we have a pretty large obesity epidemic. People's nutrition is not on point, and a healthy lifestyle has almost become a bit rare nowadays. To find people who are truly dialing in their diet, their activity levels.
Mm-hmm.
What do you see as a practitioner with people coming in? What are some of the more common pathologies or issues that people have when they come into the doctor's office, and what ends up being some of the more commonly practiced treatment methods, and how does that all relate?
Well, what do I see? So I
Yeah.
see a lot of pain.
Okay.
So I see a lot of pain. I see a lot of GI problems.
Mhm.
Like people are having like bloating, or their bowels don't move, or they
Mhm.
move too much.
Yep.
They're getting sick, like cold after cold,
Mhm.
and they don't know why they keep needing antibiotics.
Mhm.
So I'd say their GI is a lot. They have a lot of colds. There are a lot of people complaining of brain fog.
Mhm.
So I'd say that, and then and a lot of pain, like a lot of pain in younger people,
Mhm.
and I mean and when you've been practicing decades like me, then you
Mhm.
can see that there's a trend that wasn't there before.
Right.
Like the number of children with autism is like I would not see that. I mean, just in a day, like seeing
Drastically
patients,
increasing.
like the number of children, the number of like siblings and nonverbal, or all this is you can't ignore that.
Mhm.
That's been drastic in decades. But other than that, the autoimmune diseases, like so what you're seeing is so much eczema with the colds, with the asthma, with the allergies, and then
piled
all
on
these
top of each
auto,
other.
yes, because once I tell the patients, I said, hey, when you have a specialty called allergy and immunology, it
Yeah.
means your allergies are an immune problem.
Uh-huh.
So of course every time I see autoimmune, it's like there's usually some history of that eczema, and the allergies
Yeah.
before. So I would say like those are a lot of the problems that I see.
Mhm.
I tell patients when I see them, I'll say, look, when I see you in clinic and everything, I'm in this unattractive room. I have no money spent on advertising or whatever. And I am in here trying to point out that your symptoms that you're having are the result of the billions of dollars of advertising spent out there to
Right.
get you to buy those things.
Wow.
So what I try to say, this is after many, we're talking hundreds of patient visits, it seems to help more is if I is I just, try to find a couple easy things that they could do,
Mhm.
but point out that look what they're making money off of you with.
Right.
So think about that, and then do you want to save your money maybe, and or
Mhm.
just think a little bit and be like, how maybe I don't want to buy what they're telling me.
Mhm.
So when I look at it from a fascia perspective, and I know that fascia from the nutrition makes their fascia sticky.
Mhm.
And then I know that from a functional medicine perspective, then they have imbalanced metabolism, and this is making it so their immune system is off then, and they're having their GI symptoms. And then how
Mhm.
could their brain be working?
Mhm.
So I see them from both of those standpoints, and
Mhm.
I try to find the common denominator, which is usually their diet.
Yeah. Yeah, so I guess the way that I would interpret that is like if someone comes in with a poor diet, potentially not a lot of movement, the poor diet is causing the stickiness of their fascia. Less movement is causing that fascia to remain in place, less lymphatic drainage.
Yeah.
That diet is simultaneously harming their GI tract, their gut microbiome, which is also directly related to immune function, T regulatory cells, and oral tolerance. And I guess all of that would end up leading towards some sort of neurological dysfunction. As we know, a lot of neurons are built inside of the GI tract and then transported to the brain.
Yeah.
So yeah, it's very interesting to me how just very simple lifestyle measures and changes can be so interconnected, and that we're getting to a point where we know so much about the science behind these interconnected systems and how functional medicine is able to provide a new perspective on that rather than the conventional treatment mechanisms.
I wanted to add something
Yeah.
to what you're saying about the lymphatics and all that. What's interesting is people don't realize that stiff fascia is inflammatory, or can
Right.
be inflammatory.
Right.
Because what happens is that when it's stiff, there'll be factors released that will signal immune mediators
inflammatory
yes,
cytokines,
exactly, inflammatory cytokines in the setting of stiff fascia. So I'd say that we were talking earlier before we started about fascia release, and I said, well, I don't think of my work as much as fascia release as I'm interested in what we're doing that makes it stiff. Because if you do not try to help yourself not make it stiff, going every week for your fascial releasing is, in the end, it's always going to be a half a step behind.
Right.
Because you're always actually going to be, you're still the scales tip towards more stiffening.
Right.
Yeah.
Yeah.
So I would say that is my interest, because when it's stiffer, then we can guess that it's going to affect your immune system, and it's going to affect your structure and your pain and your body in general. Yeah.
So something you mentioned earlier was that you have a high prevalence of people coming in who are experiencing brain fog. And our audience is very into nootropics, cognitive function, performance enhancement. They want to be able to focus and perform at their maximum. They want to have maximum energy. And brain fog seems to be a reoccurring theme, especially among the younger generation with chronic overstimulation. I was wondering what you think some of the driving factors of that brain fog is. When people come in, how do they describe their brain fog? And what do you recommend in order to reduce that and kind of switch that scale over to the other side to where you're in a very clear cognitive state of mind?
I feel like brain fog is a kind of a very general description, and it's quite complicated. I joke that I'm more root cause than you might be ready for.
Okay.
Because I'll say we assume we're smarter than the other creatures. That's why we figured out ways to exploit things in the world and create things and all that for our own improvement of our lifestyle and enjoyment and advancement for research. So we have that thought about ourselves, and what we need is basic food, not the fancy stuff invented 10 to 15,000 years ago, more the kind of food that created this amazing organism, this amazing structure and metabolism that just that survived before all these carbohydrates were discovered and and cultivated, right?
Right.
So that counts for something. And then and how do we become creatures that are awake during the day and not become nocturnal, right? So there's something that happened in the cycle of the sunlight, and apparently humans can only see a trillionth of the possible of light frequencies. So the idea that we see the bulk of it, and there's only like a little bit of infrared and whatever that we can't see. If we see 1 trillionth. So there's so much information happening that we are just not seeing. And so that's all the information going in from the sunlight or whatever. So look how unglamorous it is. And unlike, oh, look how smart we are. It's like basic food and basic light needs, like all these other extras, they were not researched about what would happen when you're under them for 10 to 18 hours a day.
Right.
Yeah. So it's unglamorous.
I guess in the modern world it becomes more glamorous because we actually resort back to understanding the anthropological viewpoint on how humans evolved over time and what were our baseline settings essentially.
Yes, baseline settings.
Yes.
That is so true. I tell women, I say, you don't consciously say it's time for my period. Like you do, like, what is the feedback going on about that? That is all. So just as an entry point into actually considering that so much is going in that you are not aware of, and so that you would entertain that if that's the bulk of it, actually the information in, not what you're reading, not what, then that's governing how your body is working. So that's like a different way to think about it.
Very interesting.
You don't put your conscious mind at the center because that's what we do.
Right.
Oh yeah.
So, within your practice, I know you have something called the integrative body method, IBM for short.
Yeah.
I was wondering if you could explain to us what the integrative body method is.
Yeah. That method, like the original, what do they call that? The OG.
The OG.
The OG of that would be like awareness through movement, ATM from Dr. Feldenkrais. Moshe Feldenkrais, who's like a physicist, and he created this program, awareness through movement. And he, as I understand it, I don't think he did much like actual manipulation. He was helping rewiring through being aware with the movement for the brain to rewire. And probably when he was doing that, it was not much was known about fascia and what it would do. So now mine is like, well, I'm interested in like these chronic common conditions that people languish with, like TMJ pain, plantar fasciitis, vertigo, sciatica. Had your discectomy, but you still have sciatica. Well, it wasn't all your disc then, was it? You know? So these chronic low-grade things where people have to live and kind of work their life around, even painful periods for girls and women, and painful, heavy, painful periods. I found that these all have an origin in your fascia, or at least like movement and whether your fascia is stiff or not. So so anyway, mine focuses on how to help your fascia stay more elastic. What movements are your highest leverage movements that would keep because I say you're only as flexible as your stiffest player.
Right.
So you have like big muscle groups, and if those are stiff, then the ones that have to oppose those, they have to oppose them by being stiff also. So it breeds stiffness. So my work on fascia then, my method is about not just that you would be you'd be aware, and then I try to help accelerate the de-stiffening of your fascia, because the way you moved got you this level of stiffness. So you could change how you move and then wait for your fascia to remodel. Like it's maybe years and years to like or we could kind of try to help it along. So then I try to help release it so that you could see, oh, it does work. So if we change how the process of making your fascia stiffen, and if we try to help you change it so now you're not continuing the pathway of stiffening, I do the integrated body method is to help you like open that up, and it begins the opening, and then it's like you do the rest. It unravels. Does that make sense?
Yeah.
So it's that's vague, but that kind of describes what it is. You kind of have to buy in to the idea that these biggest muscle groups are on the stiffening side. And then you're going to try to change how you move. So then when you do that, then it's worth doing this other stuff to release it so that you can like unwind how tightly wound everything is. Does that make sense?
Yeah, I think that's a very important point for a lot of our audience who spend a lot of time sitting at a desk, working on a computer. Obviously your work is great, but you have to make time for movement. You have to make time for stretching out those larger muscle groups, and ensuring that you have good like range conditioning. That is very true. And what do we call it? Maybe like the crux or the central part of that is that the most influential muscle group for your whole body is arguably your thigh. Because in evolution, what did we change the most through modern living? The most might be that the thigh pelvis does not have to stretch and move in as deep a range of motion as it did, because before there were no toilets, so you would have to squat all the way to the ground. Then they're like, that's too hard, let's be smarter, so let's raise it up, and let's raise, right? So that is, then you're losing this crucial section of stretch that affects your other big muscles. I think it affects your GI function. It affects whether or not your bladder floor, your pelvic floor is going to work well. So where everyone's trying to reclaim these reclaim like their lost pelvic floor function, or or their GI function that's a problem, or their other pains. And when I think underlying that is a very rigid muscle group or groups of muscles. Right. So I was looking online, and something within the integrative body method is kind of like a theory that you abide by, and it's called the polyvagal theory. I was wondering if you could describe that a little bit more and how it integrates into functional medicine.
The way I think about it is that I think about those three sections: the structural, the metabolic, the nervous system, balance of your vagus nerve. So for polyvagal theory, which, to be current, we should say there's been some rumblings in the internet about how some other publication says that this is not true, like it's not accurate because it's polyvagal theory. But so I'm not here to debate whether or not that is true or not. What does seem to be true is that you have like a ventral vagus, vagal nerve, and a dorsal vagal nerve, and the dorsal vagal puts you into, that's the most primitive branch, and that's supposed to put you in like the most like kind of lights out, kind of like barely lights on functioning when you're like really like shut down. And that's like the most primitive state of your sympathetic parasympathetic nervous system. Then when you are evolutionary, like a little more advanced in our you go to sympathetic, which is the fight or flight, so you're going to duke it out or you're running away, but that's like sweating, running, high heart rate, everything, right? So very agitated. And then versus when you're in ventral vagal, which is like you're open, curious, you have a sense of humor, like you can laugh even when it's stressful, like then that's what we want to, so they call that the window of tolerance, or how fast you recover through the other layers is your resilience. So and so it's interesting, you want resilience and adaptability and flexibility in your structure, in your metabolism, and in your nervous system.
Resilience, adaptability, and structurability. Some great key things to abide by.
So I think there are plenty of other, I've read and been introduced to so many other smart healers, doctors, students of trying to improve health, and they all have their like, we should do it this way, whether it's 7 factors or 10 factors or whatever, but so mine is not like, oh my God, this is it. It's just that it's the 3, it's so much easier to remember 3 things. And a 3-legged stool, and that kind of way is, that's the way I would think of like really complicated people when I would see them. And they come in and they have violence in their life, or their life is so unstable, and they don't, and their diet is terrible, and they have all these injuries. Well, where do you start? There's those three. If they don't feel safe, then how can you do anything else? Right. So it can be like a lot of triage, trying to decide, well, what littlest thing can I suggest to you to help you get a grip?
Yep.
So I did have a lecture that I put on my YouTube channel, because when I would talk to people about an anti-inflammatory diet, I realized they don't know what that even means. And then I thought, well, they don't even know what inflammation means. And not really, because when we talk about anti-inflammatory diet, everybody who's like, well, it looks inflamed. To them, that means a place is red and swollen, and they're not wrong. But it's like, what does that mean in here? So the easiest way I thought to explain it to people is that inflammation means that your body is in a stress response. Instead of business as usual, humming along, it is like struggling. So that's what inflammation means. So your body is like, I think and this ties into the brain fog and screen time and the other things. Every time we are like, when you're working on things, and you think that this is the way it's always been. It's not. It's like way we're living now. Your parents did not have all those things. They didn't have the Siri and the Alexa and all that, right? And then when you talk about your grandparents, they might have like gotten up to change the channel. They got out to open the garage doors. So do you see how like every generation it's a lot different? Okay. So we have gotten away from natural living to the point where we're not even aware that we're so far away. So what I tell people is like, hey, you don't pay attention to sunlight because you don't have to, because you turn on the lights. You don't have to pay attention to when it rains for laundry because you have a dryer. And we don't pay attention to the seasons and which things are really in season, and then the doors closing on that, and that makes it precious because we have a grocery store. So that kind of sets us up for this inflammatory life that that is not it's not. We are natural beings. It's supposed to be tied to a circadian rhythm and the seasons and all, but because we more and more work with our phones and machines or computers, let's say we had a horse to travel. That horse needs a rest and water and food, and you're thinking about that. Now when you drive, you only have to give yourself a bathroom break when you absolutely need one. So now, because you're almost using yourself like a machine. So I think a big misunderstanding for the generation now is that everything is so digital, and they have not. You at least hunted, so so you had that experience of like how whole animals put together when you have to like take them apart. So instead of like playing with these creatures and having to skin them and cut the chicken up and all that, they're playing with Legos, and everything is like compartmental in pieces. That does not help us have a concept of ourselves as an integrated whole, where this part is attached and affecting another part. So that's one of the problems with this kind of separate lifestyle. So what happens, or this digital lifestyle. And so in the natural world, that when you have a hurricane or it rains, you're going to have mud for a while. The sun will come out and it will stay muddy. You understand that. But what I see over and over is that people who are like, I live an anti-inflammatory diet except on Saturday and Sunday and Friday nights. And then I say, well, what if your mud does not dry by the end of Friday? Like your 5-day work week where you're like really like good. Like they are still thinking that their body turns around like an off and on switch. But it's not, because we're natural. We're natural creatures, part of the natural world. Even on a computer, because it's part of the natural world, kind of. I mean, a little bit. You turn it off, but it's hot. So that shows you that it was working. So I wanted people to understand that I think it's easy from the way your digital life that people are living a mechanistic life, to treat yourself and actually conceive of yourself in a very like off on, binary way, and that the animals and the natural world, that's for them.
Right.
But we are them. We are
Right.
that.
Yeah.
Does that make sense?
Yeah, it makes complete sense. I think that with technological advancement, it's always been focused on the convenience of the human experience.
Yeah.
And that convenience essentially allows your baseline biological human to kind of move away from its intended functions. And so as we move away from those intended functions through convenience, it forces the body to induce micro amounts of inflammation because we're not supporting the systems we used to support.
Yes, exactly. That's right.
Yeah.
So I feel like that part is necessary to discuss the other things you wanted to bring
Right,
up.
yeah.
Because if your orientation is that all you're going to do is like it's like weak right there, it's weak right there, I'm going to plug up those holes. But the perspective is not with that that this is a natural entire integrated system that is actually quite tied to the electromagnetism of the earth and
Right.
all the wavelengths of light that come from the sun. You
Yep.
know, if you don't have that orientation, then you're missing that, and you will never catch up to,
Yep.
to feeling well.
Yeah.
Yeah.
I had a I had a friend of mine come to me a couple of days ago telling me that they were experiencing chronic brain fog. And we initially started talking about what his current lifestyle looked like. And I was like, are you working a lot? And he's like, yeah, like I'm sitting in front of my computer a lot. I'm like, are you having a good time? Like, do you feel like you are emotionally in the right place? And he's like, yeah, I don't know, maybe a little bit, maybe not. Like, I just don't feel much desire or excitement about the things that I'm doing. And I tell him, are you getting outside enough? Are you getting enough vitamin D exposure to the sunlight? Is your circadian rhythm being set properly? Are you waking up in the morning and getting sunlight in your eyes? Are you experiencing low solar angle light in the evenings via the sunset? Those are things that set your nervous system in the way that it's intended to be set, which allow you to get better recovery and better sleep, better integration of memory from the day. Obviously, like hormonal production and all of that kind of stuff. So I think it goes right back into your point, is like a lot of these things like brain fog, or what someone else might come up with and say like, oh, I have this or that. A lot of them really just come back to is, are you living the way you were evolutionarily designed to?
Yeah, are we honoring that this all evolved without our conscious controlling it?
Right.
And then now we kind of like use it and abuse it. Like because we expect it to work like a computer does or whatever, you just change the battery and we can't help it because you're relating to things like it's similar to you. So somehow we're thinking that we're that when we're not.
Yeah.
So that perspective, it's more respectful, or I think it's more actually, is it humility or an acknowledgement of like that we are not a machine? And so if we acknowledge that, then you're like, oh, that's it. Now you're not just like, oh, frickin' body, I gotta do this for it and I gotta check off this. You're like, you're using instead like a more guiding philosophy to help you live.
100%.
Yeah. So that's what I thought would be more helpful as the launch point before you talk about all these other things, because then it all falls into place much better.
Yeah, totally.
Yeah. Interesting thing about brain fog. Functional medicine, of course, it's focused to helping people, their brain function. I mean, look at Grain Brain by Dr. Perlmutter and the End of Alzheimer's by Dr. Dale Bredesen.
Yep.
I mean, showing that your loss of cognitive function is reversible and and you could intervene early.
Right.
And what we don't realize when we went towards a more, what should we say, carbohydrate, grain-based society, when we evolved cultivating grains and then cultivating also fruits, then making them sweeter and bigger and all that other stuff. So we have a very carbohydrate-based diet now. And when I say that it's not rocket science or not glamorous, when I say, well, let's look at that. they know that they are starting to call dementia type 3 diabetes.
Yep.
Okay, so carbohydrates are actually detrimental to your brain function.
Absolutely.
And when I see people and they have a lot of chronic problems, they might have had a lot of dental work. So that would reveal to me that they have a high carbohydrate based habit in their diet. And so the bacteria that make cavities and gum disease, they all eat carbs.
Yep.
So I did see, like, I try to tell all the patients that, hey, latest cancer research is that the virus and bacteria, they all use carbs for themselves. Then and we were built on a metabolism that prefers not carbs.
Right.
So when you're sick, don't have carbs because that's actually your body's already stressed in a war fighting the virus so that you will not succumb eventually then to get a secondary bacterial infection. So when you get through it by eating ramen and having your smoothie or drinking juice or whatever, you're just feeding them, not helping you. So don't add to your metabolic stress when you're sick.
Yeah.
So that's what I definitely try to explain about the so we do the brain, that the carbs are bad, the teeth, and then when you get sick, then you have this problem, right? And then carbs make your fascia stickier. So any person who has bad arthritis and or swelling when they have the swollen tissue or those pains, all made worse by carbs.
Wow.
Yep. So I'll explain, I've seen that, when I have this, then my back pain is worse.
Yep.
So I mean, so many, if you were a research bench scientist, you'd be like listing all the reasons why, but I'm just like, let's look at what is common to them all. If you want to help yourself not have these problems, right? And then cancer, so that cancer researcher in explaining about viruses and bacteria, it's because cancer is upregulated a lot of receptors to gobble up the glucose before your other cells even get to it.
Right.
So it's set up for that. So I just try to say, hey, how about that looks something easy, but that's where we come up against the billions of dollars in advertising telling you that you want to have these things because they're fun.
And they make it look colorful and it's sweet.
All that,
And I mean, even for the brain, ketone bodies are the preferred fuel source for the brain.
Yes.
Which are derived from free fatty acids, which you get through eating proteins and meats. With chronic glucose consumption, the body naturally switches off of that. So it stops using ketone bodies as the primary source of energy for the brain. And instead imports the glucose instead. Yes,
and you've upregulated all those pathways. So that's why your body can't be like, it'll struggle because you have to like kind of help it move over so that it could do a good job with that. So, and I'm big on area under the curve. Like, so that's why in my integrative body method, or the way, I don't call it that, I just say that my style is that what you're doing the most is what's going to win. Right? So you go to you look at the area under the curve and you do something in 5 discrete times. The rest of the time you're doing something else, what's going to win?
Right.
So I try to focus on the highest leverage changes that helps you with the biggest bang for your buck is another way they say it, right? So it turns out, for instance, when they did a study of prison violence and the prisoners had high carb diet, prison violence went up.
Wow.
So there's your mental, emotional health aspect of affecting your brain. And then when they improved their diet quality, prison violence went down.
Wow.
So you are robbing, every time you have carbs, you are robbing your mitochondria of the ability to give you energy to think. And
from an anthropologic point of view, then, I think it would be safe to say that early humans didn't eat nearly as close to the amount of carbohydrates that we eat today, but they certainly ate fruits, right?
Well, I had in that lecture, I think that, the inflammatory diet lecture I have, there was a study that a caveman in a year had the amount of carbs that was in one of those tall, like, Starbucks drinks.
Wow. Yeah.
So,
like
because there's no grain.
Grams of sugar, maybe.
There's no grain.
Yep.
They could maybe scrounge up some berries because we take it for granted that the fruit is natural. It's just that if you ever were like went in the woods and you found wild blueberries, they're very scrawny,
a lot smaller,
and small. Blackberries,
and they're denser in antioxidants
sour.
and vitamins.
Yes.
Yeah.
So there is something called UIMs, unimportant molecules.
Uh-huh.
So there's one of the great toxin experts, researchers in the U.S. I heard him speak a few times, Dr. Pizzorno, and he was talking about in one of his lectures about that these UIMs, what they selected out for when they crossbred and tried to get the fruit to be bigger and marketable and sturdier, whatever.
Yeah.
These turned out to be the parts of the fruit that are anti-cancer, that are like healthy for you. So because they look unimportant, that's why they call them UIMs.
Huh.
So
Interesting.
yeah, so that's, we think that we're like, oh yeah, they had that fruit's healthy, but they never had that size. And ours today is going to have a lot of the unimportant molecules out.
Yeah.
And so because we value sweets.
Yeah.
So, but theirs would have been more probably mixture of bitter and tart and all that.
Yeah, and I think we also kind of have to consider that early humans were far more active than we are. So they were able to metabolize through any sort of glucose that was absorbed through fruits, for example, or berries. They would blow through that super quickly, and they would use it essentially as fuel for hunting so that they could get their larger protein-based source of food.
Yeah. I mean, how long do we think the fruit season was? I mean,
right, yeah.
Right?
Short, very seasonal.
So that's probably why in 1 year they didn't have a lot of didn't have a lot of carbs.
Yeah, another guy that I work with, his name's Brendan, and he likes to emphasize eating seasonal fruits because your body doesn't integrate and understand the information that you get from a non-seasonal fruit when you eat it in the incorrect season.
Yes.
So he tries to abide by eating and ordering seasonal fruits in their respective seasons because that's when your body is ready to process those.
That's like a dimension of honoring that this is is integrated in the natural world. You know, the things that we can't see, like we don't know, we can't see the EMF from our phone, so we don't know that it's actually screwing up our electricity conduction, and so that's interesting about fascia too, because it's helping with electrical conductivity in your body. So like when there's a scar in there in your in your skin, and that's affecting the conductivity of the electrical signals in your body, that could give you symptoms somewhere else. Yeah. 100%. So anyway, we're electrical beings, and what affects the ion channels and the conductivity. This is diet. This is light. This is the electromagnetic fields. Yep. So he's like, so he's doing that, and then it's good. So if he's doing that in ads and is doing that in other dimensions too, then that's how you 100%. Achieve like more. I think that's how you achieve more wellness.
Yeah, absolutely.
Which isn't that what we all want?
Yeah.
Yeah. I mean, you want a highly performing brain,
right.
But you would like to feel well.
Yeah, and I think a highly performing brain comes along with the rest of your body also being highly performing. So it all kind of works together.
Well,
sure.
Because we are not little machines made out of like on a factory line.
All right, guys. That's the end of the episode. Thank you so much, Dr. Kim.
Sure.
Appreciate you taking the time to let us come over here and film this great episode with you.
Oh, well, it was fun.
Hopefully we'll catch you again.
Yeah, sure.
All right.
Looking forward to it.
Thanks, guys.